Oral cavity cancer is cancer found inside your mouth. The oral cavity includes lips, inner cheek, lower and upper jaw, floor and roof of the mouth, and tongue. Oropharyngeal cancer is a type of head and neck cancer that starts in the oropharynx, which is the middle part of your throat. The oropharynx includes base of the tongue, soft palate, the tonsils, and the side and back walls of the throat. Surgical removal of cancer in the oral cavity or oropharynx is a multi-stage procedure. The cancer tissue is carefully removed. A margin of healthy tissue will also be removed to ensure all cancer cells are eliminated. A neck dissection may be performed on one or both sides to remove at risk or involve lymph nodes. Attempts will be made to preserve all critical structures, for example, nerves that elevate the shoulder and move the lower lips. Tissue transplant, also called microvascular free flap, will be harvested for reconstruction. Common area can be skin or muscle flap from forearm, thigh, and back. If bone tissue is required, it is commonly harvested from the lower leg or shoulder blade. Reconstruction of your oral or oropharynx is performed with the harvested free flap. While the reconstructed tissue replaces the volume of the removed tissue, it may not have the same sensation or movement as your original tissue. Reconstruction involving bone will require hardware plate fixation. Commonly, a tracheostomy will be performed to help you breathe after surgery. Before your scheduled surgery, a clinical nurse specialist will reach out to you for an initial risk assessment to optimize your health before surgery. Smoking cessation and reduction of heavy alcohol intake will optimize your ability to heal after surgery. You may be referred to a dietitian or nutritionist to optimize your caloric intake before surgery. Your treatment team will help manage your symptoms before and after surgery, such as pain, oral, and wound care. You may be qualified for clinical trial. Your doctor will discuss details with you if you're eligible. Several days prior to your surgery, you will attend your pre-admission appointment, which will take about 3 hours. At the appointment, various clinical tests will be performed to assess your fitness. You will meet with an anesthesiologist. Depending on your needs, you may also need to meet other healthcare providers. You will be given instructions when you need to start fasting and what medication to continue and which ones to discontinue prior to your surgery. On the day of your surgery, you will be required to check into the hospital at least 2 hours prior to your scheduled surgery time. You will be transferred to the preoperative care unit. A member of the treatment team may place intravenous lines and other monitoring lines before going into the operating room. You will then be taken to the operating room and put under anesthesia. There will be several people in the operating room, including nursing staff, anesthesia staff, surgical team members, and trainees. The length of surgery can be several hours. After your surgery, you will be transported from the OR to post-anesthesia care unit. After recovery from your anesthesia, you will be transferred to surgical inpatient unit. You may have some or all of the following tubes attached to you. A feeding tube in your nose, surgical drain in your neck and where your graft was taken, a tracheostomy tube in your neck, lines in your blood vessels, and catheter in your bladder to drain your urine. A tracheostomy tube is placed into an opening in front of your neck that the surgeon made during the surgery. Depending on your procedure, you may not need one. It helps you breathe when your normal airway is blocked due to swelling. A tracheostomy mask is placed close to your tracheostomy tube to deliver oxygen and keep air moist. You may not be able to speak until the tracheostomy is either changed or removed, which may take a few days. If you can't talk, your nurse will give you a writing pad to help you communicate. The tracheostomy tube is usually removed prior to hospital discharge, unless specifically discussed otherwise. A nasogastric or NG tube is a feeding tube that passes through your nose and into your stomach. It delivers nutrients and medicine while your mouth is healing. If you have an NG2, this may be removed prior to your discharge when you are able to eat, or converted to a more durable feeding tube, like a gastrostomy tube. This will be discussed by your treatment team. An IV is used to deliver fluid and medicine quickly via the veins in your arm or hand. It is used both during and after surgery. It will be removed when you're ready to be discharged. A urinary catheter is a plastic tube placed in your bladder during surgery. It's used to drain urine from your bladder into a small bag. It will be taken out a day after your surgery. You may have a wound dressing over the area where your graft was taken for reconstruction. This may include a simple dressing or a cast depending on where the tissue is taken. The casts are typically removed a week after surgery. Several drains will be placed near your incisions, such as the neck and side of your flap. They help remove extra fluid around your incision and wound. It can be removed a few days after your surgery. You will also have a sequential compression device around your lower and upper leg. This helps circulation and prevent blood clots. It will be removed when you can get out of bed. You will feel pain, which is normal after surgery. Your treatment team will provide you with various medication to help control your pain. You will have swelling around your face and neck. Swelling takes several days and sometimes weeks to improve. It's important to mobilize after you wake from your surgery. Doing the following activities will speed up your recovery for a faster discharge. Deep breathing and coughing to clear your lungs and prevent lung infection. Maintain good oral hygiene. A mouth rinse may be provided during your hospital stay. Wiggle your toes and feet to help blood in your legs circulate. Walk as soon as your surgical, nursing, and physiotherapy team deem appropriate. Your team may also instruct you to do some exercises to help with shoulder function after surgery. How long you stay in the hospital depends on how well your pain is controlled and how well you can eat and breathe. This is typically between 7 to 14 days. Your nurse works with you to help you get ready to leave the hospital. Before your discharge, arrange for someone to pick you up and take you home on the day of discharge. Talk to your healthcare team if you need help. You will receive prescription for medications, including pain medications to manage your pain at home. Your surgical and speech-language pathology team will determine the optimum diet for you after surgery, depending on safety and tolerability. You may have a discharge plan that may include a community nurse to help with wound care and other issues. It is important to observe the incisions and wound for any changes and signs of infection, such as increased swelling, redness, and pain. Clean your incision with mild soap and water. Do not aim shower head directly on your incision. Let water run over them. Gently pat dry with towel. Clean your wounds with instructions given to you by your team. If you still have staples and stitches, your home care nurse or family doctor will remove them. Stitches inside your mouth are dissolvable. Smoking cessation and reduction of alcohol intake may reduce your risk of developing another head and neck cancer. Talk to your healthcare team if you need help or are interested in quitting smoking and drinking. You may feel more constipated due to pain medication. Take medications recommended by your team to improve your bowel movements. Restart your normal life activities when you feel ready. Listen to your body and stop when you feel tired. Don't lift anything heavier than 20 pounds for the first 2 weeks. You can start driving after you stop taking pain medications, and move your neck comfortably to check your blind spots or side mirrors. When you can go back to work depends on your recovery. Your surgeon will let you know when it is safe to return to work. You will have a post-operative follow-up appointment with your surgeon about 2 weeks after your surgery. Don't hesitate to contact your clinical nurse specialist if you have any questions or concerns when you're recovering at home. Going through head and neck surgery can be overwhelming. Talk to your healthcare team if you need support coping with your diagnosis and treatment.